So moving on, we have a little bit of time left for our panel discussion. This may be a little bit of a Q&A session to start with. I'd like to open up initially all the questions that there wasn't an opportunity to ask earlier. So I'll open this first of all to students and early career researchers and give you an opportunity to ask any questions or raise any points for discussion that occur to you first of all.
Hi, really great talks. Calum, I just wanted to ask you, but first of all say it's really amazing to see the impact of the UK ASARIC consortium and really harrowing as well. What do you think, or if there is anything, what would you change about the ASARIC protocol and maybe the workforce if we went through all of that again?
It's a highly loaded question from Reby, who
Sorry.
was one of our star people in the Liverpool outbreak laboratory and who took responsibility for slicing and dicing the samples. So thank you and thank your team. There's so much that we would do differently. The commissioning process was we were commissioned to gather data on 1,000 patients in wave 1 and 1,000 patients if there was a wave 2 and if there was sufficient patients, and we recruited 301 times more than that. And consequently, our administrative facility and our financial model was wrong, and consequently, we didn't have the foresight to put in place the staff. Having got staff volunteers, and it was volunteers, there was people who came off other projects and other parts of the university came in. We trained them up. We had some of the mothers of the staff making reusable PPE, so that because we didn't have access to PPE to use in our own laboratory to do this work that was vital to our nation. Having trained them up, we didn't have the ability to retain them, and consequently, as soon as COVID was over, they went on and got good jobs and good careers elsewhere because they'd now been trained up in CL3 technique, but we didn't manage to retain them for our own university's purposes. So I think I would like to think that we could get core funding to support ourselves going forward to maintain an outbreak laboratory capability. At present, that hasn't happened. That's the big one. The case report forms are actually incredibly simple. We would probably make them simpler still and be more robust in resisting daft political requests to look into things like, is blood group really important? Because the answer is it might be, but what are you going to do with that information? Just because somebody's got blood group 00, are you going to decline them treatment at the front door? Actually, your front door treatment has to be on what the patient looks like at the time when they present. So you don't really need things like that. What you really need to understand is what are the druggable targets, who needs prioritization for care. And we did get a lot of daft commissions right at the start. But yeah, our model for how we acted over-relied on volunteers and goodwill. That's what I think. I should ask you, what would you do differently? But...
Thank you very much. A question here at the front.
Hi, thank you very much. It's very enlightenment for me. And in the field of pandemic preparedness, I'm probably quite new in that field, but I'm actually quite curious. So to be able to prepare for a pandemic, you basically have to monitor and survey what's in the field. I think I've read an article before about this sort of hunting of viruses, hunting for pathogens, high risk pathogens, and in between of their activities, they were actually cut off by the government. And I wanted to know what are your insights regarding that kind of positions. What as a scientist, what would you do, and how would you communicate or convince your people about the research that you're doing? And I mean, we have beautiful data and we have beautiful project and everything, but if you can't convince your politicians and public, it's a bit hard to do as well. So I'd like to know what your insights about it. Thank you.
Thank you very much. Would any member of the panel like to take that question?
Interesting question, but there can be quite a lot wrapped up in there. So I'm not an expert in surveillance. I can say, and then I'm sure Calum or can answer, but certainly that is one of, I mean, the strengthening surveillance systems is one of, certainly in our interviews on pandemic preparedness, one of the things that is emphasized most. Yeah, I'm not sure what country you're talking about. I guess I can speak more to the sort of politics of why these things might or might not be funded or might be shut down. I mean, I can imagine that in certain contexts it's quite sensitive to be doing that kind of work. I'm not sure where you're from, so I'm sure there. In fact, I know there are politics that impinge there on what kind of surveillance is possible, or indeed what results are made available. Well, we know there's a whole history of that, isn't there? Not only for yeah. So I think the latter part of your question, I think you were picking up more on how can one effectively implement preparedness measures. Yeah. I mean, I think, I think the point that we would make as social scientists is that it's not just a technical exercise, that preparedness, but also response are social and political processes, and they involve these, the best kinds of responses or preparedness plans involve very good state-citizen relations, positive, trusted leadership, and that wasn't always present in many contexts. And as you heard also from Tabitha's presentation, in certain populations that are marginalized, if they don't trust state actions, even if they might in fact have anxieties about disease, they would not necessarily go to state facilities to get things like vaccines. So I guess, one of my conclusions, particularly being involved actually in the WHO roadmap groups, what was really striking to me actually was that there were no political scientists in that social science group, and we gradually brought them in. But I think that's partly because social science historically in these interdisciplinary kinds of health spaces has been framed as behavioral science, rather than this sort of attention more critically to some of these sort of structural factors, issues like state-citizen relations, the importance of politics. And I think there's a certain almost concern amongst biomedical scientists of actually getting into politics. It's seen to somehow cloud neutral science, but I would argue that it's absolutely essential, and that we need to bring those people into the room to really help us in the future with better preparedness and response.
I think we totally missed the opportunity to involve communication scientists, people that understand how to influence, and that's a combination of what you were talking about motivating society. But in those developed parts of the world, actually probably in all parts of the world, there's experts in persuading you to use alcohol, tobacco, sugary drinks, processed foods, and vapes. And they employ communication scientists working for the dark side. And we need to pay the same people more money to work for the white side, the good side, and promote that. And we totally missed the boat. Instead, we did the traditional thing of putting a pale male in front of a camera, or a lady with a perm and a twin set, and we just didn't get it right. I'm sorry, we just totally dropped the ball on that. So.
Yeah, and I think, asking that question where the Tabitha's research was asking who is trusted to be communicating in this setting. So it's shaping the messages, all that nudge theory and so on, which I agree is sort of part of the wider sort of pie, but it's also thinking about who is trusted, and that was why that sort of community champion approach really was kind of became really prominent, particularly around vaccine inequity.
I think I would maybe just add that the conversation around communication, I think, often stops too soon. I think there's an emphasis on how do we shape the messages that are going out to people. But I think that it's important to, oh, thank you. Oh, that's quite loud. There's a lot of emphasis on how we shape the messages that go out to people, and I think not enough emphasis on listening to people and having a two-way flow of information. So what we tried to do really in this project with young people is to really hear their perspectives, make space for them to express their concerns, ask their questions, talk about their other priorities. Hayley was talking about the uncertainties that people were experiencing, everyday uncertainties and precarities that people were experiencing in African settings. Well, here in Ealing, we have young people who are, even not sure where the next meal is going to come from, and speaking to their concerns and priorities as well is important in terms of building trust and creating the conditions in which they are more receptive to a conversation and to messages, co-designing messages as well with people from communities.
Yeah, I think it's a very complex question, and there is no simple answer, and there is no unique answer for it. It depends what you have as a scientist and a medical expert on the other side among the politicians. You can have smart people, skilled, and with the goodwill to help their nation and to arrange everything as much as they can. And on the other side, you can have a narcissist or some people who are really I don't know what to say. I would not to be rude, but we faced all of that during that pandemic all over the world. We in Croatia had a very good situation with our government because the president was a very smart guy who really have sense to listen the scientists and the professionals and to really engage all the resources to help and to actually, we didn't have a day without PPE. In any healthcare worker did not be in a position that it is not protected. We did everything together with the government that the vaccines and the therapeutics and ventilators or everything for the treatment will be affordable for everyone, although we don't have the same conditions in different hospitals and everything. So if you will be able to do such kind of good communication from the both sides, honest, so you have to be relevant, you don't need to hide facts, you need to be very open and said, and brave sometimes that say, I don't think that it is good what you're planning to do to the politician, although he is a president of the government or minister, then they respect you and then they will obey what you're talking about. And if the general population see that there is synergy in that communication, they will be more trustful than in an opposite side. On the other way, in politics, you have always the fight between the position and opposition. And that was a big challenge in many countries because the opposition, at the beginning, they were at the same side because they're humans, they were frightened, they have relatives, they worry about themselves. But then they realize that they are losing their power because the people who are in the position are doing good things for the nation. So they started to be on the opposite side. Have been involved in many not constructive things, like they were against vaccines, against the measures, against everything what the officially professionals recommended. So it's kind of ongoing process, and I think that in the future we really need to have, and they really need to have some consequences for that manner. It cannot be, okay, I'm opposition, I have right to be an opposite side, or I'm in a position and I can do whatever I would like, or promote some fake drugs and whatever. So I think that in the future, in such terrible conditions and threats, they need to be controlled and, I don't know, responsible for what they're doing. It's easy to say, it's very difficult to establish that.
Thank you very much, everyone. That is 5 o'clock. We have come to the end of our allocated time. I don't want to keep people, but if anyone is able to stay on and wants to have a conversation, then we will probably be here for a few more minutes. I'd just like to say thank you very much to all the members of our panel for some fantastic presentations. Thank you very much. And I'd also like to thank everyone in the audience for your attention and for some really insightful questions.